Tanya is one of the 59,000 or so people still waiting for the results of her tests. Right now, COVID-19 tests are strictly limited to those in high-risk categories or people who are experiencing serious symptoms. For more information on how to schedule a test in LA County, go to SpectrumNews1.com. This morning, the coronavirus death toll in New York rose to 2,900. Health officials in California anticipate the number of deaths in this state to climb steadily over the coming weeks, even with all the social distancing measures in place. Joining us right now is Dr. Mauricio Heilbron. He's the Vice Chief of Staff at St. Mary Medical Center in Long Beach. Dr. Mo, what's it like at your hospital now?
It's pretty stressful. We all know what's out there, and like I tell my friends and family, it's not that coronavirus isn't serious. Just for us, it's another serious. It's on top of everything else we have to deal with. Heart attacks, car accidents, whatever. But this is an extra level of stress we haven't seen before. The ER physicians and nurses and therapists are rising to levels we have not ever seen before, and it's something really to see. I'm just a trauma surgeon, so while I'm sort of on the front lines, it's nothing compared to what these guys are going through.
Just a trauma surgeon. Probably not many people in your lifetime you're going to hear say that, but he can, because he is. Let me ask you this. We're all looking for some kind of magic, silver bullet or cure. What about ibuprofen? Is that helpful to this or not? Or tell me what your thoughts are on that.
The whole ibuprofen sort of rumor started from a kind of esoteric small letter that was printed by two physicians from Switzerland and Greece in a British journal. And the letter, just a letter, wasn't a study, had this idea, this hypothesis that several drugs elevate a certain protein that might be important in this disease, and ibuprofen was on the list. That was it. And wow. People ran with it. And in fact, if you keep reading the article, the bottom of the article says, this is just a hypothesis. This is a recommendation for further study. There are no recommendations on removing any drugs. And in fact, most of the medical community came out right afterwards and said, hey, there's no evidence against ibuprofen. Boy. However, you know happened ever since then. Yeah,
well, it's a novel, virus, so there's no evidence of pretty much of anything. We know pretty much of what it was from the previous ones, the SARS and N1, H1, or whatever. I'm not even sure about that. But yeah, again, we're all looking for something, and it's going. But let me ask you this: if you are feeling sick and you're not sure what's going on, when do you say, okay, it's time to go to the hospital?
So this is the hard part, because this involves a little bit of common sense. So if you wouldn't have gone to the hospital before, don't go now. So if you have a mild sore throat, a mild fever, you're going to be fine. Stay at home. And on the opposite is if you're really sick and you're short of breath and you're getting a hard time to breathe, and other people looking at you like, dude, you need to go to the hospital. But there's that in-between stuff that's sort of difficult to manage. So let's say you have a fever that's a little higher than you're comfortable with, a cough that is worse than your normal allergy or something like that. If there's something off, you need to trust yourself. But you have other avenues. Call your primary care doctor. Call your health plan. At St. Mary Medical Center, they have a virtual thing where you can, if you log on to their website, you can actually talk to somebody and help you sort out your symptoms and see if you need to come see somebody.
Yeah, I know that's getting popular, obviously, for obvious reasons now. But we have 45 seconds. Let me ask you this. If somebody's coming out of this, or they're done, they had the coronavirus, and they made it, now they're okay, do they have something in their bodies we could use?
Maybe, and that's an excellent question, but we're right in the middle of a research study here. We're living an experiment. So yeah, we'll figure that out. Right now, let's not go there.
Right. Well, Dr. Mo, I appreciate that, and do your best to stay safe and keep our people safe out there. And we promise we're not going to go to the hospital unless we absolutely need it. And thank you so much for taking the time. I know you're busy.
Nice to be here.